Raise the bed to carer's hip level. Ask patient to fold hands across chest. Lay the maxi tube on the bed next to patient to make sure the sheet is under the part of the patient's body you are going to move, and also that it is facing the direction in which it is going to move. Hold the slide sheet between forefinger and middle finger, i.e. scissor grip. Place the hand flat and palm down on the mattress. Gently push the maxi tube under the lower part of the patient's back, just above the waistband in the lumbar arch, pressing slightly into the mattress. When your hand appears on the other side of the patient, grasp the sheet while removing your hand to ensure it stays in place. Flatten out the sheet. To remove the maxi tube, place one hand in between the two layers of tube, grasping the bottom layer, and gently pull the tube out. Ensure you only pull the bottom layer. If the top layer is pulled by mistake, the patient will move and may suffer skin shear. Fit the maxi tube using the bridging technique, ensuring that the open sides of the maxi tube are facing each side of the bed. Ask the patient to lift their head and shoulders off the bed and using their elbows and feet push themselves back. To remove the maxi tube, place one hand in between the two layers and grasping the bottom layer gently, pull the maxi tube out. Once again, ensure you only pull the bottom sheet. If the top sheet is pulled by mistake, the patient will move and may suffer skin shear. Fit the maxi tube using the bridging technique. Offer encouragement by pushing lightly on the patient's hip as they use the trapeze to slide up the bed. Encourage the patient to bend their knees as much as possible as it helps them to push. Remove the maxi tube using the usual technique. Fit the maxi tube using the scissors technique. Assist the patient to bend both knees and bring both feet towards the side of the bed. Standing close to the bed, slide the patient's hips towards you. Remove the sheet. To sit a patient up on the edge of the bed, utilizing normal movement, first drop one of the patient's feet over the edge of the bed, which will help them with counterbalance. The patient then uses her arm, which is closest to the side of the bed, to assist with sitting up. At the same time, the carer guides the patient's upper body movement by transferring her own body weight from one foot to the other. The technique here is shown with the patient sitting in the Arjo Correndo, which is a height-adjustable hygiene chair. The maxi tube is positioned as shown, making sure the open sides are towards the carers. Work the real layer of the maxi tube down towards the patient's waist, making sure there is some material left above the shoulders. The sling is then passed between the maxi tube and the back of the seat. Ensure the seam at the commode aperture of the sling is positioned in contact with the seat of the chair. The maxi tube can be removed at this point, and the leg of the sling positioned. In cases where the patient is unable to lift their legs, the maxi-tube can also be used to fit the leg sections as shown. The maxi-tube is removed prior to using the hoist. As previously shown, this technique can be used with a patient who cannot sit forward in the chair or sits in a moulded seat and requires a sling to be fitted for use with a hoist. The maxi-tube is fitted by pushing and sliding the rear layer of the tube down behind the patient. In this case, the plastic head supports have been removed to assist with fitting the sling, and also to prevent discomfort for the patient when the sling is being positioned. The sling slides between the maxi-tube and the back of the chair until the head support and shoulder straps are in the desired position. If the patient is likely to move about during the technique, the maxi-tube should be left in position to allow for final adjustments prior to lifting. However, it is then removed before using the hoist. This demonstration shows the movement of the maxi-tube behind the patient. As you can see, the tube does not create friction on the patient's back, as the rear layer of the maxi-tube is the only layer to move.